Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair in the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team and am the lead for Emory's COVID-19 videos where we discuss important topics about the pandemic. Today, I am pleased to be joined by Dr. Sharon Pappas. Dr. Pappas is the Chief Nurse Executive for Emory Healthcare. She is a member of Emory Healthcare and the Woodruff Health Sciences Center's senior leadership teams and is responsible for nursing practice across all of Emory's hospitals, ambulatory care settings, and post-acute agencies. Welcome, Dr. Pappas.
Thank you so much. Glad to be here.
Thank you. I'm thrilled to have you here today to discuss a really important topic as we discuss the impact the pandemic has had on the nursing shortage across the United States, focusing specifically on how it's going at the Emory care settings. Just so everyone is aware of what is going on across the United States, during the pandemic, the hospital nursing work has been challenging, of course. According to an American Hospital Association data brief and new Nursing Solutions study, a recent National Registered Nurse turnover rate is 18.7%, illustrating the magnitude of the issue faced by hospitals and their ability to manage nursing staff. The same study also found that almost 36% of hospitals reported a nurse vacancy rate of greater than 10%, which is up 24% across hospitals prior to the pandemic. Some nurses have left the profession for new opportunities during this pandemic. Others have retired or have chosen to travel in nursing positions. The additional loss of nurses has intensified the shortage gap that we already saw. So we're going to start there, Dr. Pappas. As we enter the third year of the pandemic, consistently what we've heard and what we have witnessed is the extreme burden that the healthcare system has taken on during this pandemic. How was Emory Healthcare doing with nursing staffing prior to the pandemic?
Sure, that's a great question. And, one that I'll answer in a couple of ways. First of all, I think it's really wonderful, and which is one of the things that drew me to Emory Healthcare, was the fact that both our board as well as our senior leaders had an expectation that all of our organizations would achieve magnet recognition. And a lot of people only know that by just the name magnet. But what that really represents, magnet was actually derived from a research study back in the 80s, which determined that there are certain things that when they exist in a hospital, it becomes a place where nurses want to practice. And these are things like how they're led, the type of leadership. It's like how decisions are made. It's about professionalism, autonomy, being able to measure the results of nursing work and improve it. All of these things really roll up into what we refer to as the magnet model, which is how you're evaluated to become a magnet organization. And as you know, Dr. Guest, we have 4 of our hospitals that are designated as magnet hospitals, and we actually have a 5th operating unit, which is our Emory Clinic, that had their appraisal visit recently, and now we're waiting to find out if they will also be designated. So the thing of that is that every one of our hospitals and clinics are aware of the magnet structure, aware of the magnet requirements, and the importance of a good nursing work environment for retention. So I think we kind of start there. As a foundation that existed way prior to the pandemic. One of our hospitals, Emory St. Joseph's, has been a magnet hospital for 7 designations. So 7 times 4 years means they've been a magnet hospital for close to 25 years. So you can see how important a good nursing work environment is to Emory Healthcare. So we start there, and I will tell you that our turnover prior to the pandemic for clinical nurses, those people who take care of patients every day, the turnover in those group of nurses was 12.5%. That is really low when you compare to a national average, even prior to the pandemic, of somewhere around 16 or 17%. Now, Emory is just like the rest of the hospitals in the country, where we have actually suffered an increase in our turnover across the last 2 years. But that pre-pandemic state of magnet hospitals, of low turnover, of strong nurse engagement, which is part of the credentials of being a magnet hospital, and also of really good patient outcomes because of nurse engagement were all present prior to the pandemic, and we will return there. It'll just take a little time.
I think that that is so wonderful that you pointed out how important that working environment is to the nursing staff, and how that translates to patient outcomes. We want to make sure that that's always, what we're thinking about. So Emory started off in a better place than a lot of hospital systems with the nursing staffing that was available and engaged in the system. Since the pandemic, now, as I said earlier, rolling into our third year, so 24 full months of working in this pandemic, how are things looking across the Emory system?
Well, as I mentioned before, our turnover is now, in the neighborhood of about 18%. And we do have more vacancies than we had prior to the pandemic. And we're in the process of replacing those. And Emory has addressed some important things that we heard from our workforce about their benefits and their compensation. And we've addressed a lot of those that I think are playing a big role now in bringing nurses back in to Emory Healthcare. But one of the things that's remarkably different are our number of nurse residents that we typically see. In the course of a year prior to the pandemic, we were increasing the number of nurse residents that we hired, every year. And this year we have a lofty goal of bringing in 700 nurse residents into Emory Healthcare, and we're pacing there. It's so important that we have ways not just to attract these residents, but also to be able to give them an experience of learning that is one that prepares them very well for the different roles that are here at Emory Healthcare that they will fill. And so that is one very big difference that we have done. Some of the other things that have been important is that we have mechanisms that nurses can continue to learn and grow while they're at Emory. Just like physicians, board certification is an important element of nursing excellence. And so when you think about some of the programs we have for nurses to come in and become certified in their specialty, like critical care nursing, medical surgical nursing, perioperative nursing, oncology nursing, and many others, all of these are available to nurses by getting a practice experience and then also sitting for an exam that credentials them to work in that specialty. And then we pay you more for you to have that specialty as well. So all of these things, to me, begin to line up with our Emory Healthcare true north of being a place where people come to learn and grow. And those are very important elements because what you learn at Emory is like not many others because of the patient complexity that we have here, and the fact that patients come here when many times we're their last stop because they haven't been able to solve their problems. And so, it's wonderful to be able to see those patients recover, which is one of the very important parts of nurses being called to work toward their purpose. And I think that's what really contributes to their own well-being.
With the nurse residents, that's such an incredible program to have started. How long is that resident program, and are we seeing that they stay at Emory when they're done?
Yeah, that's a great question. Nurse residencies are something that vary a lot across the country, and I wish that wasn't so, because when I came here to Emory about 5 years ago, one of our objectives was to actually credential our residency with the same organization that credentials our own School of Nursing. That's the CCNE. And that credentialed residency means that when you enter our nurse residency, you know what to expect. You know that there will be ways that not only support your knowledge growth, but also support you as a learning how to take care of patients, learning how to work on teams, learning how to be part of multi-professional teams, and really get focused on patient outcomes. And so it's broader than just what many people refer to as orientation. So it's much broader than that. And actually our residency lasts about 12 months, not because you're out of patient care for 12 months, but because as you take on more and more responsibilities in direct patient care, we're supporting you in making sure that that you're adapting to that okay, with monthly groups that actually talk about how do you stay happy, healthy, and doing what you love. And so that's our nurse residency. But I feel strongly that, if you hear something called a nurse residency, look very closely, because you want to make sure that these are all credentialed residencies with a couple of organizations across the country that do that. We also have a second residency that many people don't know a lot about, but it's our critical care residency for advanced practice nurses, for them to be able to come in and become an advanced practice provider. Both nurses and PAs can enter this residency, and it is a year of proctored and mentored practice in our critical care areas that is also nationally credentialed, and is sought after by many nurses who want that type of onboarding experience.
Those programs are really fantastic. And I love the fact that you also made sure that you gave the warning to make sure that these are credentialed programs. I do want to give a shout out to the School of Nursing at Emory. The US News and Report just came out with national rankings. And again, we see that the nursing program at Emory is ranked #2 in the country, which is really exciting, and certainly is an incredible pipeline to work with our incredible Emory Healthcare system.
Yeah, Emory Healthcare is actually the largest employer of Emory School of Nursing graduates, and we want to keep that status because we know how great the Emory School of Nursing students are. We have programs that allow them to actually begin their work with us before they even graduate. And that is an opportunity that many people just can't pass up, and we're always glad to have that strong partnership and to work directly with the school, both in development of curriculum and clinical experiences, as well as celebrating the success of many of the students that finish there.
And is this a pipeline that you see as we want to make sure that hospitals do stay fully staffed with nursing? So again, to provide the best patient care, is having an academic institution there with a nursing school that is so robust and wonderful as Emory's really significant player in keeping our nursing numbers high?
Yeah, it absolutely is, for a couple of reasons. One is just the pure quality of education and the very high state board pass rate that their graduates achieve. But the second one is that I have found Emory School of Nursing does not have a faculty shortage, which you hear about from a lot of schools of nursing where they can't recruit faculty. Well, our School of Nursing does a wonderful job recruiting faculty, and so we're able to, through our partnership, we're able to say things like, wow, can you increase enrollment because you have faculty? And so they've been very responsive, developing programs like in Emory, where the whole cohort of students does all of their clinical experience in Emory facilities, so that by the time they're completed, they're practice ready and have a lot of knowledge about our system, like how to become a nurse who practices in a magnet organization. That's an important differentiator for us, and we want to make sure that we include that in their pre-licensure education. So, the partnership with the School of Nursing has just been an incredible opportunity to refine some of these things that we know are important to nurses and important to patients.
Moving back to some nursing shortage issues across the country, Emory luckily is having less of an impact, although no impact for that. Is this in any way affecting patient care that we see within the hospitals? And given that it's a shortage, what are you all doing to make sure that it does not impact patient care?
Great question. And I will tell you that that is our number one objective, to make sure that our patients get the care they need. And, that is both a function of, are there enough nurses taking care of patients? And the other function is, are the nurses who are taking care of patients well prepared to do so? And so, I think both of those things have to be present to be confident in answering your questions, that we do not feel like patients are being impacted. Some of the things that we have done is that where we have had extreme shortages, we have actually partnered with a contractor, a vendor, and we only partner with a very small number because we want to make sure the quality of these nurses is high. And we actually supplement our own employed nurses with nurses from an agency. And we monitor that very closely to make sure that their onboarding is preparing them to deliver on the high bar of care that is expected at Emory. And we also make sure that the nurses who come to us are nurses that are people that reflect our nursing mission to the people they care for, as well as the teams like physicians and many others who work closely with them to take care of patients. When you think about, nurses, I really do hold a high accountability as the chief nurse that we always are able to provide an adequate surveillance system because nurses are the people who are there 24/7, overseeing patient care, making sure that patients stay out of danger. And I don't want to use that word danger in a scary way. I want to use it in a way that would give people comfort to know that nursing surveillance is in effect. I think that having enough nurses to make sure there's adequate eyes on patients, and also to make sure when those eyes see things that they're concerned about, that they know how to intervene and actually impact the care in a way that the patients have a better outcome. So I take that job very seriously, and I want to make sure that the people who are hearing us talk today don't get concerned that we might not have enough nurses. Sure, we would love to have more of our own Emory Healthcare nurses, and we will get there. But I think that we make sure that there's an adequate number taking care of our patients that come to us.
I think, Dr. Pappas, anyone listening to you talk about the mission of what you do and the care you provide for those who do work in the nursing system across Emory Healthcare will recognize that you're making sure that there are plenty of people there to care for the patients that come into the hospital.
Yep.
This pandemic has been really stressful, and it's been really stressful for everyone. It has been a different kind of stressful for people who work in public health and people who work in the healthcare system. And so can you talk for a moment about what it's been like to work in a hospital in nursing during the time of a pandemic?
Yeah, I really heard a nurse make a comment one day that has really stuck with me, and one that has been kind of my motivator to work a little faster and do all I can to correct this. She said to me, she says, "I just feel like I'm failing at something every day."
Mm.
And when you think about the fact that, here come a large number of patients like we had never cared for before, and we were changing our approach to those patients on a regular basis to make sure that we were using the right treatments, we were using the right mechanisms to protect spread of the deadly virus, and a lot of those things, we're really having to make a lot of changes quickly. And so when you think about that, it really kind of rattles you, as a clinician, when you think about, wow, I've always done it this way. Now I'm doing it this way, and tomorrow I may do it a different way. And so, those are the kind of things that we really tried to listen to. And I remember having several moments when I would convene a Zoom call of nurses who were on our system practice council, and I would bring them together to get their feedback and advice on some of the changes we were making, just so that we could make sure that what we were doing was a reflection of what the people who were on the front line felt like were the best things to do. And so, the impact of all of this 2 years of pandemic, has really been rough. Because if you think about that nurse who said, I feel like I'm failing at something every day, that wears on you, because we all were called into the roles that we have as nurses and physicians and other clinicians, because we want to serve and we want to make life better for people. And so we feel like that these opportunities that we have to restore some of that is incredibly important. We also realize that nurses and others' ability to be able to talk about the things that they encountered throughout the pandemic was important. And I feel very proud that that our leaders here at Emory Healthcare actually have created an Office of Wellbeing that is really going to help us to develop our knowledge and our capabilities around clinician well-being. so that as we recover from the stages of the pandemic and as we begin to recreate our new nursing workforce and nursing work environment, that we have the best of science around well-being at our fingertips in order to be able to support our people, because that's really at the core of our strategic initiatives. It's at the core of what we do to be able to improve lives and provide hope.
And that's improving lives of those who work with you and for you in Emory Healthcare, as well as the patients.
Exactly. That's everyone. And we want that to be felt by our people.
I feel that from you, just talking to you about this. As we wrap up today, I do want to ask you about what's it going to look like in the peri-pandemic or post-pandemic phase. We know that our case numbers are down. They may not stay down consistently as we learn to live with this virus, but there's been a lot of delay of routine healthcare procedures and support that's been needed. How do you see that playing out in the hospital in the next year to 2 years?
Well, I really am strongly committed to open for business. I know that there's a lot of delayed care, and I want to make sure that we're ready to provide it when people are comfortable, are needing to come back into clinics, into hospitals in order to receive that care. I think that some of the ways that we're bridging this is that we have a system-wide project going on now. We fondly call care model, and because we're actually looking at our care model. It's an interprofessional team that is taking many different aspects of our direct care and saying, how can we augment our care while we're still in the process of hiring replacements for people maybe who need a break, or people who have shifted to another practice setting for a while, out of the very complex hospital role. And so, how do we augment those teams in order to make sure that we're able to say open for business? And so I'll give you a couple of examples. One is that, here at Emory, we have a lot of experience with what we call our EICU, which is our big technology hub that monitors critical care patients through technology to complement the staffing that's right in our intensive care units. Well, we've taken some learning from that, and using that same hub of EICU, we're actually piloting an acute care version of that, so that if we have an acute care unit that maybe has an increased number of nurse residents on the night shift or on the day shift, we want to be able to have them backed up with an experienced nurse on the other end of a monitor and a telephone, so that they're actually able to see the patient through cameras and through technology to actually support the nurse right there at the bedside. And so we're piloting that at one of our hospitals and look forward to see what we learn from that. We're also looking at other people who are providing care at the unit level. Take, for example, a clinical pharmacist. Is it always a requirement that a nurse or a physician perform a medication history? And how could we engage a clinical pharmacist or clinical pharmacy tech in order to collect a patient's medication history that would augment the physician or the nursing clinician that's on the unit? So just a couple of examples of some of the care model work that we're doing to make sure our patients get what they need, but also that we're supplementing what our staff might need from a unit by unit basis.
Are some of these advances a product of the pandemic? Are we going to see some positive outcomes that happen in the way we care for patients in the hospital based on the work that's been done in the past 2 years?
Oh, yes, I think so. I mean, we are gaining so much confidence with technology, and technology is improving. We're really, I don't think we would have ever dreamed of having an acute care version of our critical care hub. I don't think we would have dreamed of that prior to the pandemic. And now Mother Necessity has made us evaluate that and look at it in a different way. I don't think some of the workforce shortages would have occurred prior to the pandemic. And now what we're seeing is forcing us not only to think outside the box, but to think without a box, and think about, how can we do this better? because we have this need. So you are exactly right, Dr. Guest, that we have actually been innovators because of necessity. And so I think that's been a real positive. And I don't look for us to go back. I think this is a new model and a new workforce and a new time.
I love being able to find those silver linings in this pandemic that we've all suffered through from the past 2 years and that we're not out of yet. Dr. Pappas, thank you so much for all the care you provide, all the leadership you provide for Emory Healthcare, and for speaking with us today. I feel so incredibly confident that you are providing the best experience possible for Emory Healthcare and all the patients who come to be seen there, as well as everyone who works there. So thank you so much for all that you do.
It is my great pleasure. I feel privileged to serve here. So thank you for the interview.
Absolutely. Everyone watching, thank you so much for joining us today.